I'm Dr. Marc Lebel, acupuncturist, homeopath, and specialist in auriculotherapy and auricular medicine. I trained here in Los Angeles, where I still work, and also in China and in France. I've taught in various countries of the world. At the moment, I'm concentrating mainly on auricular medicine with a group in France known as the International College of Auricular Medicine and Auriculotherapy, based in Dijon. I found out about EECP when a friend of mine who had undergone a quadruple bypass ran into some complications about a year afterwards. He was seeking, for someone who could help him, and he couldn't go through surgery again. So he ran into Sarah. 20 years later, this patient is still crediting Sarah with saving his life. I did send Sarah some patients over the years. I can think of 2 cases which were, I think, dramatic. The first one was a 70-year-old patient who had contracted a bad flu, which was affecting his heart. His ejection fraction rate was 36. I sent him to an herbalist and to Sarah. And after 5 weeks of treatment, his ejection rate had gone up to 57, and the patient is still well and healthy. The second one was a patient in her mid-60s who was experiencing atrial fibrillation. Various conventional methods were looked into, but she chose to do Sarah's, and within a few weeks, she was free of atrial fibrillation. For myself, I took the program. I'm into my second course of it in 2 years. I'm doing it for prevention, for better memory, better energy, and preventing any circulatory problems that, may develop over the years as we get older. Sarah's technique involves wrapping cuffs around the 2 big muscle groups of the legs, the calves and the thighs, and with computerized accuracy, just begin to take over from the heartbeat itself and push blood all over the body, therefore bringing nutrients, oxygen, all over the different organs, the kidneys, the liver, the pancreas, the brain. And by repeating this treatment, you irrigate the body, you oxygenate the body, and you rejuvenate the organs, and you prevent blockages, and you essentially regress aging. Most disorders involve hypoxia, a decrease in the level of oxygen to the cells, and EECP reverses that. I think it retones vessels, retones the arteries, softens the arteries, which have a tendency to harden as we get older. It's essentially like a passive cardiovascular treatment for an hour every day for 5 days a week for 7 weeks. So it really is a regeneration treatment for the body. And one of the benefits of ECP that I found within the first week is I felt like exercising a lot more. I slept a lot better, and I had more energy. Immediately, the need to exercise was manifested. I felt like exercising a lot more than I did before. And so since it gives you a 7-week program of regimented treatments at the same time every day, if you can help it, suddenly you're back into an exercise mode, which you keep up after this. And I intend to do it once a year. So it's very helpful. There are people there in the clinic that are 80, 90 years old, and they're still doing it, and they're in great shape, mentally fit, which is inspiring to see, really. If you bring more blood flow to the brain, you prevent, major illnesses, since, the brain is our main computer. Through stress and through the wrong diet and through aging, the arteries in the body become harder. And as a result of it, blood pressure will go up. So some patients suffer from terrible high blood pressure. High blood pressure will lead to strokes easily, which is devastating. Some people don't recover very well. Some people don't recover at all. One of the features of Sarah's program is the education. Every session gives you a new lecture on nutrition, cardiovascular health, health in general, exercise, meditation, stress relieving techniques, etc. So you're essentially being educated. And all the material she talks about is available right there at her office. If you want the latest in the best oils like avocado oils, or the best water to drink, the foods to eat, it's all there. The program is done gradually, carefully. The patient is well monitored the whole time. There's assistants in the room. He's being checked several times during that hour. And so essentially it's a re-education program as well. All patients that I've sent to Sarah's program have benefited and have been happy with it. Nobody's dropped out. Nobody's complained. People are happy there. They have better energy. They have better skin tone. They have better muscle tone. They feel they're doing something positive. I've known Sarah since 1995. She's a very enthusiastic person, extremely versed in her field. You can ask her any question, and she knows about cardiology. She knows about medicine in general. She knows alternative. She knows conventional. And she knows nutrition, exercise. She herself exercises a lot. She's healthy. She's enthusiastic. And she has the right kind of information. And she's extremely dedicated to helping people. She's given classes all over. She's just totally versed. She is the program. I consider Sarah to be a pioneer in the work she did. She took studies, put them together in a program, and for the last almost 20 years has been gathering material based on the positive results. Nobody else does it. She's trained many cardiologists in this area to do it as well in their office. But she is the prime center. She's the authority in this field. And it's a tremendous service to people. It's changed lives. It changes lives every day. It takes people that are extremely ill at times and brings them right back over that 7-week program. It's quite marvelous, really. By doing EECP, I feel that it's like going to a retreat for 7 weeks. I feel I have a handle on what I need to do to maintain good health. It's like getting a complete overhaul. I'm Dr. Marc Lebel from Los Angeles. I'm very grateful that the kind of program that Sarah put together exists. It's helped a lot of my patients. It's helped me, and I'm sure it's going to continue helping a lot of people. It is cutting edge and extremely useful to the community. And for that, I'm extremely grateful and happy.